Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Laboratorial news. This audio podcast as part of a Hella LabZtorm. This audio podcast as part of a Corolla Brolder, and this audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit a sort of a background to what is CKD or what is chronic kidney disease. So CKD is an irreversible, long-standing, or long-term condition in which a reduced renal function is evident, and or damaged kidneys are unable to or cannot filter blood as per normal physiology. CKD is a major public health concern because there is a considerable overlap between CKD CKD and the risk of developing other sort of primary conditions, and the risk of developing the primary sort of conditions, and CKD also increases with age. And in the United Kingdom, there has been an effort in across sort of primary and sort of secondary sort of health sectors where for some time now there has been an effort to preclude those who are suspect or at risk of going into CKD by those who are suspect or high risk of going into CKD, where in the United Kingdom there has been an effort to uh, to um, to highlight the work to highlight the importance around the prevention, for example, of acute kidney injury or AKI. And there is a risk of dying from AKI than other conditions such as MI or myocardial infarction, cancer, forms of cancer, and heart failure, for example. And due to increasing prevalences, there is a higher risk to develop CKD or end stage renal disease or ESRD as a result in line to specific primary conditions. So there are several risk factors that interact with the disease, and patients or healthcare service users can also be affected by the socioeconomic status in addition in addition to age, gender, serum phosphate levels, parathyroid hormone levels, and bone metabolism. In some particular forms of CKD, for example, as well, in some forms of CKD, there is a link between bone and mineral metabolism. So CKD or end stage renal disease is sort of a continuum on receiving or where healthcare service users can sort of at the severe parts of CKD, of the severe parts of CKD, can have forms of replacement therapies, forms of replacement modalities such as hemodialysis or alternative replacement sort of treatments until, for example, healthcare service users receive a transplant. Although again, a transplant, just to elaborate or emphasize, is that a transplant is also a form of a replacement modality. Creatinine being a biomarker remains sort of the gold standard biomarker for renal function, And the estimated glomerular filtration rate, or EGFR, is a calculation that allows a general evaluation of creatinine in blood filtered over 24 hours. Uh, in the peer reviewed publication from 2020, the collaborative works from 2020, there is an overview. An overview that looks at CKD severity, the CKD severity linked with CKD classification. So, for example, CKD stage 1 is a CKD stage 1 being where there's possible renal damage or kidney damage, but it's undetectable. Stage 2, much like stage 1, and then stage 3, which has two parts, stage 3A and 3B. 3A and 3B, and between stages 3 and 5 are CKD stages where amongst the general amongst the population, and irrespective of age, thus in the young population, amongst the young population, in the young population, and also in sort of the adult population, where CKD stage 3, between CKD stage 3 to 5, can cause there can be sort of deficiencies in the glomerular filtration rate, and thus the nephrons, or the functional components of renal anatomy, to filter blood through the kidneys, to and where at the same time toxins from the blood as well to be rid of through urine are compromised, and so stage 3, CKD stage 3, between CKD stage 3 and 5 are the more sort of severe, are sort of the more severe part, are toward the more severe side of CKDs, of CKD. It is CKD stage 4 and 5, however. It is CKD stage 4 and 5, however, where specialists between healthcare sectors, primary care and secondary care, sort of prep healthcare service users to be sort of worked up towards having a form of replacement therapy. So in the peer review publication, which will be available across Storm Robotics production social media, will be accessible to sort of go through. So that draws this audio podcast to a close. This audio podcast as part of the Laboratorial news. This audio podcast as part of a Hella LabZtorm. This audio podcast as part of a Crowell Browder, and this audio podcast as part of a Storm Robotics production.